Thank you, Chair Guthrie, Ranking Member Eshoo, Ranking Member Pallone, and the members of the Subcommittee of Health. Thank you for giving me the opportunity to testify today. My name is Sarah Schumann, and I'm the operator of Brookside Inn and Brookside Rehabilitation in Castle Rock, Colorado, just south of Denver. I'm here to talk to you about the long-term care workforce and how the recently proposed staffing mandate from the Centers for Medicare and Medicaid Services will have dangerous consequences, specifically limiting access to care for our most vulnerable. I'm a second-generation nursing home operator. My father, a physician, founded our organization. I grew up in a multi-generational household, and we had the privilege to serve 3 of my grandparents who eventually lived and passed in our communities. My mother, my grandmother, 3 of my great-grandparents, and numerous aunts were all licensed registered nurses. Inspired by the nurturing of these women, I chose to become a chaplain and a certified nursing assistant. My life has been blessed with a deep love for our elders and profound admiration of nurses. Having dedicated my adult life to seniors in long-term care, I can say without a doubt that this is more than just a job. That's why the current workforce challenges and the looming federal staffing mandate are heartbreaking and terrifying. We are still in recovery mode from the challenges of the pandemic. Our staff are true heroes. Nursing homes are facing a historic labor shortage, and the proposed staffing mandate will only make things worse. Colorado is one of the fastest growing elderly populations, but like the rest of our nation, our caregiver workforce cannot keep pace. We are doing everything we can to recruit more caregivers, but there are significant obstacles. All of our local healthcare providers are recruiting nurses as well. To attract more workers, Brookside has increased our wages by more than 40% in almost all caregiver positions. We have increased our benefits package. But even with the higher pay and better incentives, we are still facing hiring challenges simply because the number of qualified caregivers that we need are not there. Unfortunately, at times we have had to turn to costly staffing agencies. I am concerned the staffing mandate would have the unintended consequence of increasing the use of agency staff. That is not the best solution for quality of care for our residents, and it's financially unsustainable. In one of our facilities, 85% of our residents rely on Medicaid. A recent analysis of the staffing mandate found that facilities with a higher Medicaid census were less likely to meet the proposed requirements. Again, I am concerned that the administration does not realize the unintended consequences of this policy and how it will disproportionately impact underprivileged seniors and underserved communities. Like most of the profession, Wall Street does not own my company. We serve residents on Medicaid, and we do not have the resources to fund this unfunded mandate. I am terrified we would be unable to continue serving seniors in our community. We are not alone in this fear. Nearly 300,000 nursing home residents nationwide could be displaced and left scrambling for alternative care if this mandate proceeds. In 2016, prior to the pandemic, I began my quest to Congress asking for workforce relief. We entered the pandemic with staffing challenges, and those challenges have persisted. We cannot be expected to just magically grow new caregivers. Instead of an impossible mandate, something that 94% of nursing homes, mine included, cannot currently meet, we should be implementing solutions together, such as workforce recruitment programs, student loan forgiveness, and tax credits for those choosing to work in our profession. And we should be investing in our nursing schools and learning institutions to help build a pipeline of caregivers for a growing elderly population. The caregivers in our nursing homes care deeply for our beloved residents. The work we do is sacred. This is one of the most compassionate and selfless professions in the world, and we need your support. As I wrap up my time with you, I'd like to ask the committee, is there a way we can work together to create supportive policies that will actually make a difference in the lives of our seniors and our long-term care staff? How can we together serve our precious elders? How can we collaborate to support our nursing professionals? Can we together create solutions to develop a much-needed workforce for skilled nursing communities? Thank you.